Hi, I'm here with Andrea Gallagher, President of Senior Concerns. Thank you for being here, Andrea.
Thank you for having me.
Yeah, so tell me a little bit about Senior Concerns.
So we're a 44-year-old nonprofit in the community. We actually started with Meals on Wheels in the Thousand Oaks community and built an adult day program. We have a caregiver support center, senior advocacy, pro bono legal and financial services, and a lot of community education.
Okay, and how did you first get involved with the organization?
Oh, that's an interesting story. My husband and I moved to a new house in Westlake, and we had a come meet your neighbors party. And in walked this couple, our neighbors 3 doors down, Fred and Hildy. And lovely couple, older couple. And we had a lovely evening that night. And then what happened is, over the next couple of weeks, Hildy called and said Fred was having a birthday party. Would we like to come? And I said to my husband, oh, this will be nice. We'll meet the kids, the grandkids. So we get to the restaurant, and it's just Fred and Hildy. And we realized they had no kids. They had no living relatives. They really had no one. Fast forward about 4 months, and Hildy called us. She didn't drive. She had macular degeneration. Fred was sort of her caregiver. And she said, could you take Fred and I to the hospital? He has to have some day surgery. So we went. Fred built the 23 out here, so we went the 23 to the hospital. And as we got there, they took Fred in, and we sat there. And then what happened is the doctor came out afterwards and said that, unfortunately, things hadn't gone well, and Fred's kidneys had shut down, and he was going to be in the hospital for 3 weeks. So from there, Fred asked us if we would stay with Hildy at the house. And we did. Second night in, she had one of those chairs, those electric chairs that go up and down the stairs.
Right.
Electric chair coming down the stairs. We rushed to her. It's the middle of the night. And she was all dressed, lipstick on, purse in hand. And we said, Hildy, what are you doing? And she said, I want to take you kids out for pancakes. And I said, okay, but it's 2:30 in the morning. And she didn't understand. And that's when we realized that there was a level of cognitive impairment there also. So we cared for Fred and Hildy for 6 years through his stroke, through her dementia, through end of life, and every step of the way, Senior Concerns was there as a way for me to have a touch point, because I'd never done any of this before.
Right.
So after Fred and Hildy passed, I joined the board of Senior Concerns. I was on the board for 5 years, and now I've been running the organization for 7.
Wow. So that exact situation where you became the caregivers for your friends,
Yes.
when you weren't necessarily trained or prepared for that, is exactly what Senior Concerns is all about, right?
Absolutely, absolutely.
So let's talk some numbers. What qualifies as senior?
Well, technically speaking, they're all over the board. Most places would say 60 plus,
Okay.
sometimes 65 plus. I'm 61. I would never consider myself a senior.
Of course
I
not.
know 90-year-olds that don't consider themselves seniors. So
Right.
it's really, to qualify for any program that we have, the only program that has a qualification of age is our Meals on Wheels program.
Okay.
And that's age 60 plus.
So what percentage of our population falls somewhere within that senior spectrum?
Yeah. So I'll give you an interesting statistic. In 1960, 12% of our United States population was age 65 plus. By 2060, it's going to be 30%. 1 in 3 people is going to be over the age of 65.
Wow.
We're becoming a nation of old people.
Talk a little bit about the programs that you provide and the services that you provide.
Mm-hmm. So our adult day program that we have is for folks that are either physically or cognitively impaired. So think of somebody who might have Parkinson's or Alzheimer's disease or has suffered a stroke, that they shouldn't be or don't want to be alone at home during the day, but are looking for a place to have socialization, great nutrition, exercise therapy, pet therapy, music, gardening. It's a wonderful, it's a non-medical program. However, we can help people with their medications, with toileting, with things like that. And we're open 5 days a week from 7:30 in the morning till 5:30 at night. So whether you're a spouse caring for a loved one or an adult child caring for your loved one, you can, for instance, go to work or do your activities, get some respite, and your loved one will be in a safe, nurturing environment.
So for some of those programs that you described as non-medical, even though technically they may not be called that, I imagine there are some huge health benefits to that kind of thing.
Oh,
right?
without a doubt. So, for instance, social isolation, there's a statistic that says that socially isolated people, it's equal to smoking 15 cigarettes a day.
Wow.
So there are so many things that happen with social isolation, from lack of proper nutrition to if you're not engaging with someone else in conversation, the brain is not functioning, not moving well.
Right.
So there's lots of health benefits to being in a social environment.
So can you explain what challenges caregivers take and sort of what they take on that they may not have realized?
Sure. So I'll use Fred and Hildy, for instance. So when my husband Peter and I started to help out Fred and Hildy, it was with simple things. Can we pick you up something at the grocery store? Can we hang your Christmas lights for you? That type of thing. And then over time, Fred had a stroke. And so we were caring for Hildy during that period of time. We were looking for a caregiver, a paid caregiver who could be there when my husband and I could not. We were taking Fred he went from the hospital to a skilled nursing facility and then over time back home, but with PT and occupational therapy. So arranging all of that. Medications. And then as time went on and Hildy was having her cognitive impairment and things were getting more difficult for her, whether it's doctor's appointments and testing and making sure that the house was safe because she was not being able to, she would turn on the stove, for instance, and didn't realize she had turned it on and walk away and things like that. So I often say that the caregiving experience starts with a little toe dip in the water, and before you know it, you're over your head.
Yeah.
And so to have an expert or a set of people who have lived through this before, seen it, done it, have been able to vet a lot of the paid providers in the community for things is a wonderful resource to have.
Right, because it's not just about being there to provide support, but you need to understand what kind of support you need to really understand what you're dealing with and how best to provide care.
And then also to deal with the emotional side of things. I mean, it was, my husband and I contributed a lot financially, a lot socially, but a tremendous amount also took its toll on us emotionally. I mean, there were times I was depressed. I gained 40 pounds during that period of time. And because I wasn't taking care of myself, which most family caregivers don't take care of themselves.
Right. So you talked about the increasing rates of senior citizens through 2060. How are you going to deal with some of those challenges as an organization? Because it seems like there will just be a growing need. As that population ages, the demand and the need for your services will increase.
Yeah.
How are you prepared to deal with that?
Yeah, so there's a couple of what I would call things that are creating the perfect storm. The first one is that we're seeing this huge growth in age 65 plus population, and the biggest growth comes from those age 85 plus. That's going to quadruple over the next couple of years.
Wow.
And we're seeing a lot less family caregivers that are able to care for their loved one because baby boomers, for instance, had a lot less children than the populations before them. And kids these days don't live next to their parents. Mm-hmm. And the cost of care is astronomical. For instance, 1 year in a memory care facility can be as much as $80,000 to $100,000.
Wow.
The average senior has income of about $24,000 in the Conejo Valley.
Wow.
So obviously you can see that's difficult. So the first place we like to start is with education. It would be great if we could catch people early rather than when they're in the midst of a crisis. So helping people to understand, how are you going to fund your long-term care? Who is going to take care of you? What kind of things are going to, more than likely happen to you as you get older, and how are you going to adapt to them?
So some preventative education, right?
Yes.
Do you provide education and training programs for both caregivers or soon-to-be caregivers and soon-to-be senior citizens to help them prepare? Yes,
both of them, and both in community and in our offices.
Okay, that's great.
Mm-hmm.
What are some things that you're excited about? What are things that are moving in the right direction that are maybe making your job a little bit easier?
Mm-hmm. So I think people are becoming more aware, because they're caring for their aging parents, of the kind of challenges that may occur. And so this is a wonderful wake-up call for adult children that are currently dealing with aging parents. Not necessarily always a pleasant one, but one that will help them think about their own future. That's number one. The other thing is, business follows demographics. So the fact that we're seeing such huge growth in the age 65 plus population means business is interested in that. So we're seeing a lot of new technology, whether it's home health technology or assistive devices and things that can help seniors as they age in place in their homes. So those are positive things that I see. Another positive thing I see is that seniors themselves are interested in figuring out how they're going to solve the equation. Oftentimes, if you ask the average senior, do you want to move into an assisted living facility as you age? Most say no. Most say I want to live at home. So they've started programs. For instance, we have a program in our community called the Village Program, where you can join membership. You don't have to live in a specific town, but in the Conejo Valley. And then you bring your talents to that group, and they bring their talents. So for instance, if I was really good at cooking and somebody were willing to be a driver and I didn't drive and I needed help getting to my doctor's appointment, we could make trades for our services.
That's great. And I imagine technology really helps the coordination of those types of groups.
Absolutely.
So for anyone who's interested in helping Senior Concerns, what can they do?
So the first thing I'd say is volunteering is a wonderful opportunity. Get to know us. We have lots of volunteer opportunities, of course, at our bargain boutique and thrift shop, which I'm sure we'll talk about in a minute. But in addition to that, delivering Meals on Wheels, working with some of our seniors in our adult day program. So that's a great place to start. And then also we have a number of events and folks can volunteer for those. But in addition to that, donating. 65% of the money that we work with all year long is from donations. So every dollar that's provided is really used to help a senior and their family make their lives easier as they're dealing with a crisis or a challenge. I can't see a more noble activity than caring for the people that built this community, that built us, that gave us the freedoms that we have today.
Right. And speaking of donating, there's a very direct way to do that through the Senior Concerns Bargain Boutique and Thrift Store.
Yes, so we are housed in the Community Conscience Building. Actually, we've been there since its inception. And folks can donate gently used items to the thrift store, and we sell them, and that money goes to funding programs and scholarships for our adult day program and for Meals on Wheels. So whether it's donating or working in the store or come shop, There's great finds to be had.
So you've been in the Community Conscience Building for 30 years now. What has it meant to be part of Community Conscience and be one of the organizations within that building?
Yeah. So from a financial standpoint, it's meant that we've received well over $1 million in the funds that are provided and the free rent that's given to us. So the funds that we make at the Bargain Boutique, as well as the free rent, which helps us to make even more money. So financially, it's been a tremendous asset to Senior Concerns. But more importantly, the nice thing is that we have a network of organizations to work with under that roof that give us the opportunity to know directly what services are being done and how we can, for instance, guide our seniors over to use them when it's appropriate. We also provide for Lutheran Social Services, which is in the under one roof, a Community Conscience Building. We provide them vouchers for folks that are homeless who need clothing and other items that we have at the thrift store.
That's great. Any upcoming events that people should be aware of?
Yes, we have our biggest event, which is called our Ultimate Dining Experience, and that's October 19th this year. It's at the Hyatt Westlake, and this year's theme is a speakeasy. So we're excited about that. It's a gourmet dining experience. You come in, and there'll be 5 chefs and 5 wineries out in the garden, along with a silent auction. And then you go into the ballroom, and there's a 3-course meal and a program there, and a live auction, and then music. It's really a fun event, and people dress up into whatever the theme is.
So Andrea Gallagher, President of Senior Concerns, thank you for joining us and for talking about this. If you want to know more about Senior Concerns, you can visit their website at seniorconcerns.org.